Hello, my name is Michael Gallagher. I'm a board-certified clinical specialist in sports physical therapy. All right, don't turn the video off. Sports physical therapy is one area of physical therapy, and you may be saying, well, I'm not an athlete. Why am I watching this video? Well, in my 34-year career, 32-year career in private practice, a large portion of my patient population is the geriatric patient. That means that there are not only young, healthy athletes coming in here, there are many older people with other concerns, arthritic changes at the joints. I feel stiff, I feel sore, I have other medical conditions like diabetes or high blood pressure. Well, none of those things should exclude you from participating in this exercise video. My motivation for making this video is just that in this time during self-quarantine when we can't leave the house, many of my older patients have said, I'm getting very stiff. I'm sitting home and my mother's not doing very well. She feels great, but she's become very sedentary. She lays in bed all day. She sits on the couch. These videos, or this series of videos, again, is to help to combat just that, what I like to call post-quarantine or quarantine syndrome. Yes, I've stayed in my house. I haven't gotten ill. I haven't gotten COVID-19 or the coronavirus. But look at all the horrible things that have happened to me. Having a hard time going up and down the stairs. My back is stiff. My neck hurts. So on the series of videos, what I'm going to try to do is present you with a simple exercise program that you can do along with me to help eliminate or alleviate some of the conditions or problems that may occur when you're at home, less active, unable to go outside. So we'll make it a little bit easy. The first thing we're going to do is have a seat in a chair. I know you're happy already. Something fun to do. Let's sit down. We're all able to do that. And we're going to start with the upper part of our body today. So today we're going to start with some neck exercises. I don't like doing volatile or very forced neck motions. So what we're going to do is some gentle, simple, straight plane motions. What I'm going to do is I'm going to move a little closer so you can see what we're doing here. And nice and easy, what we're going to do, our first motion is slowly bring the chin down towards your chest, bringing the head forward. In the motion, like you're saying yes. We're going to go as far as we can comfortably without feeling pain. None of these exercises should cause pain. Discomfort or stretching is fine. No painful motions should be continued. If it hurts, we'll try a different way to do it. And we're going to hold for 5 seconds. And next we're going to look up and we're going to bring the head back and look straight towards the ceiling. And again, as far as we can comfortably without pain, stretching is fine. And again, holding 3, 4, 5, and back to a neutral position. With these exercises, you want to make sure we don't overextend. We don't want to become dizzy. You don't want to feel uncomfortable. Stretching, again, is fine. The next motion is we're going to slowly turn to the right. So turning our head, keeping it neutral, sitting up nice and tall, and holding. 1, 2, 3, 4, 5, and now to the left, and holding. 1, 2, 3, 4, 5, and back to the middle. Hopefully that felt okay. If any of those motions are uncomfortable, we can eliminate or avoid those motions during the exercise session. Or go half the distance, go as far as you can. So let's again look up towards the ceiling, stretching out the front part of the neck, some of the chest musculature. 3, 4, 5. And again, down, chin down to chest. 1, 2, 3, 4, 5. Back up, looking straight ahead, sitting straight up. We're going to bring or turn to the right. 1, 2, 3, 4, 5, and turn to the left slowly. 1, 2, 3, 4, 5. Feeling a stretch on that other side or the contralateral side. Again, we're going to up towards the ceiling. Head back and hold. 1, 2, 3, 4, 5. Head down, chin down to chest. Roll slowly. You'll feel that in the upper part of the back, across the shoulder blades. 3, 4, 5. Back looking up at the camera or your screen. And now turn to the right. 1, 2, 3, 4, 5. And now to the left. 1, 2, 3, 4, 5. And back to the middle. 2 more repetitions to go. Up towards the ceiling. 1, 2, 3, 4, 5. Chin down to the floor. 1, 2, 3, 4, 5. Back up to neutral. And now turning to the right. 1, 2, 3, 4, 5. And now to the left. 1, 2, 3, 4, 5, and back to the middle. What I'm hoping is each time you do this motion, you feel that you've gained a little bit of flexibility. You can go a little further each time. And even you may try to want to push or stretch it a little bit further each time. Shouldn't be painful. I want to repeat that again. Shouldn't be getting dizzy during these exercises. If any time they become uncomfortable, stop. We'll skip forward to the next part of the video session. Our last time, we're going to look up towards the ceiling. 1, 2, 3, 4, 5. And looking down. 1, 2, 3, 4, 5. Straight ahead and turn to the right. 1, 2, 3, 4, 5. And now to the left. 1, 2, 3, 4, 5. And back to the middle. Well, hopefully that felt okay. Just starting to stretch out the neck musculature, which will make our next exercises a little bit easier for us. We're going to now concentrate on the shoulder. This is a combination of a stretch and a strengthening activity. So what we're going to do is with your right hand, we're going to reach over your head, like you're raising your hand in a classroom, as high as you can, kind of reaching towards the ceiling. Reach up, and what you're now going to do is turn your palm over, facing the back wall, and hold. 1, 2, 3, 4, 5. Now turn the palm in the opposite direction, facing the video screen, and hold. 1, 2, 3, 4, 5, and down. And let's try the opposite side. Again, raising the hand as high as you can above your head, really trying to reach for that ceiling. And turn the palm towards the back wall and hold. 1, 2, 3, 4, 5. Turn the palm over towards your screen and hold. 1, 2, 3, 4, 5, and down. Now that you should feel stretching underneath the arm, along your flank, along the side of your body. You may even start to feel that shoulder work a little bit. We are using the muscles to do that activity, so we're getting a stretch and some strengthening at the same time. Not only working on shoulder flexion, but by turning over the palm, we're working on rotation, what they call internal and external rotation. The shoulder's a ball and a socket joint. There's many movements at the shoulder. We want to stretch out the entire shoulder capsule, all of the tissue surrounding the shoulder. So let's go back to the right arm. We're going to reach up towards the ceiling as high as we can. We're going to turn the palm towards the back wall And we're going to hold. 1, 2, 3, 4, 5. Turn the palm in the opposite direction and hold. 1, 2, 3, 4, 5, and down. Left arm up, reaching as high as you can towards the ceiling, and turn the palm back towards the wall and hold. 1, 2, 3, 4, 5. Palm facing forward. Sit up nice and straight. 1, 2, 3, 4, 5, and down. All right, here we go on the right arm again. Lift it up, turn the palm back, and hold. 1, 2, 3, 4, 5, and opposite direction. 1, 2, 3, 4, 5, and down. And we're going back to the left side. Bring it up, reach towards the ceiling, turn the palm backwards, and hold. 1, 2, 3, 4, 5. Palm forward and hold. 1, 2, and again remember to try sit straight up if we can. 4, 5, and down. So that exercise and stretch may cause you to feel a little fatigue, a little discomfort in the arms. So now we want to go from a strengthening or partially strengthening exercise to a little bit more stretching. So this is a little easier, but a little more complicated, so you have to pay attention. What we're going to do is we're going to take your right hand and we're going to place it on your left shoulder, kind of like Simon says. We're going to bring the elbow out in front of you, and now with your opposite hand, so in this case your left hand, you're going to grab your elbow and push straight back towards your chin, stretching out behind the shoulder. 1, 2, 3, 4, 5, and bring them both down slowly. Now we're going to bring the left hand to the right shoulder. We're going to bring the elbow up. We're going to push back. And again, holding. 1, 2, 3, 4, 5, and slowly down. Again, at that exercise, what you should be feeling is the stretch behind the shoulder, in your scapular, or those wing bones in your back. So time for the right hand to the left shoulder, elbow up, push straight towards you, almost like you're choking yourself. Bring your arm around your neck. 1, 2, 3, 4, 5, and bring them both down. And now left hand, right shoulder, elbow up, and bring it across. 1, 2, 3, 4, 5, and down. Right arm, left shoulder, elbow up, across, and hold. 1, 2, 3, 4, 5, and down. Left arm into right shoulder, elbow up, and hold. 1, 2, 3, 4, 5, and down. Okay, the next stretch we're going to do is to work on underneath the arms and working on a motion we call abduction, a motion to the side. So we're going to kind of do a half jumping jack. We're going to take our right arm, we're going to bring it over our head, palm facing up, and we're going to reach for the floor with our left hand. And hold. 1, 2, 3, 4, 5, and slowly down, all the way down. Now left hand, palm facing upward. We're going to bring it up and over our head and reach for the floor with our right hand. 1, 2, 3, 4, 5, and bring it down slowly. The down motion just as important as the up motion. Right hand over and touch the floor. 1, 2, 3, 4, 5, and down. And left hand up and over, reaching for the floor with the right hand. 1, 2, 3, 4, 5, and down. Let's do 2 more on each side. You take the right arm up and over, reaching for the floor with the left hand. 1, and you should feel that stretch all through here and underneath the arm. 4, 5, and down. And again, up and over, palm facing towards the ceiling, now facing the floor, reaching. 2, 3, 4, 5, and down. 1 more time on each. Right arm up and over the head, reaching for the floor. 1, 2, 3, 4, 5, and last one. Arm up, palm facing towards the ceiling and over. Reach for the floor with the right hand. 1, 2, 3, 4, 5, and down. And relax. What I generally recommend is counting your exercises aloud. Most people have a tendency of holding their breath when they're exercising. May cause you to pass out and fall out of your chair. We don't want that to happen. My recommendation is by counting aloud or by verbalizing the 5 seconds. If air is coming out, air has to be coming in. Just helps us to remember to breathe during our exercise. Hope you enjoyed your first exercise session. Hope you're looking forward to the next one and will join me. We'll continue working towards the trunk and the lower body, and then we'll continue on to some strengthening. Balance exercise, gait activities. As we go, many people say, hey, I'm getting older, I'm having problems with my balance. I feel unsteady on the stairs, I feel unsteady walking. I'd like to cover all of those issues, or as many as I can, in this series of video. Thank you. Look forward to talking to you again.